Congratulations on your acceptance to Boston University and welcome to the Health Science program at Sargent College, the College of Health and Rehabilitation Sciences. I'm Dr. Bria Dunham. I'm both a professor within the program and the program's director. And while I would normally love to greet you in person to welcome you to the program, I hope that this virtual presentation can serve to give you a bit of a taste of what the program offers and show you just how excited we are to have you joining us. The curriculum in the health science program includes a strong foundation through how to critically evaluate sources of health information and write about them, of introduction to the field of global health, where you'll really look at health problems that cut across national boundaries and how we can use health equity as a frame for addressing those challenges, both domestically and around the world. Well, you'll more fully investigate the ecological and environmental determinants of health, including the climate crisis as massive challenges faced by the human population, as well as explore health policy through our course in Organization and Delivery of the U.S. Healthcare System. You'll use your course in epidemiology to really get a grounding in this investigatory branch of public health and a strong understanding of how we use quantitative data to really look at exposures and outcomes of health problems. And then you'll pair that with a course in qualitative research strategies to go beyond the numbers and look at how we can bring in qualitative evidence and understanding how to address health problems. You'll gain experience in a job setting through a structured internship in the health science practicum. And then you'll also have the opportunity to dive more deeply into one or more topic areas through your choice of a senior seminar in areas such as non-communicable disease, global maternal and child health, healthcare interventions in low and middle income countries, comparative healthcare systems, gender and healthcare, emerging infectious diseases, which quite a popular topic these days, as well as the social determinants of health. But the question we always get in these open houses is whether you can be a health science major and be pre-med, to which our answer is yes, of course you can be pre-med. Or you can be pre-PA, pre-PT, pre-NP. The health science major really offers you a flexible curriculum that has optional pathways that allow you to complete your prerequisites for any number of graduate clinical programs alongside the requirements of the major. Our students also can receive additional support via the pre-professional advising office towards their application to and entry into a clinical graduate program. So there are four main highlights of the health science program that I want to make sure I address with you in this time that we have together. Our focus on global public health, our strong advising model, our health science practicum, and our close relationship with the School of Public Health through our BS MPH dual degree program. So, as a program, you should know that our focus is explicitly global. We have faculty expertise in the Americas, Africa, and Asia, where we draw upon our own interdisciplinary backgrounds as a faculty in really looking at both the challenges in those settings and how they relate to challenges that we experience right here in the United States. We have an explicitly global focus in our coursework, which I think comes through very clearly in our classes. And between our strong relationships with BU Study Abroad and International Service Learning, we can offer opportunities across 6 continents for students to dive more deeply into the work that you're interested in pursuing. We also have an explicitly undergraduate focus in our work. We're an undergraduate only program. And so that really builds both pedagogical and mentoring expertise specifically for students who, like yourself will soon be, are in their years of undergraduate study. In addition to the close one-on-one work that students do with their faculty advisors, because all students are assigned to a member of the faculty for academic advising. There's also our program office where students can meet with me or the senior program coordinator for additional support when needed. We also at the college level have strong advising support through the Academic Services Center, where students can seek support on applications for studying abroad, get connected to resources around the university, look into how to pursue a double major or dual degree, and so forth. And as I've already mentioned, there's also the pre-professional advising office that will work specifically with students that are planning on pursuing graduate study in the clinical professions. So I've mentioned the practicum, but at this point you might be wondering, what is it? So it's essentially a supervised structured internship that provides a semester-long experiential learning opportunity within a healthcare or a public health setting that's supervised both by a healthcare or public health professional on site and a faculty member of BU. The purpose of the practicum is really to help reinforce the skills that are learned through coursework and build this really powerful experience and opportunity to help you further engage with the world of work and careers that you might wish to move into. It consists of a minimum of 120 on-site hours, and there are opportunities to complete the practicum both within Boston and abroad through a number of our study abroad opportunities. For our practicum, we've recently had students placed at the Massachusetts Department of Health, the Boston Public Health Commission, the Sloan Epidemiology Center, at Massachusetts General Hospital, and actually several hospitals in the Boston area, as well as the Boston University Office of Environmental Health and Safety and Disaster Management. And I've also mentioned the dual degree relationship that we have with the School of Public Health through our combined program that allows you to potentially, if you were interested, pursue both your Bachelor of Science in Health Science and your Master in Public Health within only 5 years of full-time study rather than the 6 years that such a combination would usually require. Students may apply for the BS either in the spring of their sophomore year or in the fall of junior year, at which point they'd meet with me to discuss their eligibility for applying, for me to explain a bit about the application process, and then also talk about how the MPH would fit into their own career goals. There are 4 courses that students are required to take in the BS prior to graduating with the Bachelor of Science and matriculating for the +1 year. And those 4 courses count for both degrees. They fulfill part of the 128 credit hours that are needed for the undergraduate degree, as well as counting towards 16 of the credit hours that will be needed in the MPH and fulfilling specific foundational requirements before continuing into more specialized coursework. So where do students go after graduation? Well, a number of them go into the BSMPH or into graduate study in other schools of public health, clinical training to become physicians or physical therapists or nurse practitioners, into business school, into graduate programs in education, or in many cases directly into the workforce, sometimes in opportunities that roll into a first job offer after the practicum, in areas in public health, in healthcare, social services, research, and really the opportunities are endless. We know that the overwhelming majority of our students do end up working in a public health setting or clinical field or completing graduate study within about a year of graduation. And with nearly half of our students actually continuing on specifically to graduate study. So with that, good luck. Congratulations again. And we can't wait to welcome you in the fall.